Well, we are coming to you this week from the J.P. Morgan Healthcare Conference. Obviously, it is one of the most important issues in the country. The most recent Fox News poll shows that 83% of Americans are concerned about healthcare. More than anything else, my next guest is looking to help with that. Joining me now in an exclusive interview is the CEO of Privia Healthcare, Shawn Morris. Privia Health is CEO. Shawn, great to see you. Thanks so much for joining us.
Thank you for having me.
And you announced a new partnership on Monday. Tell us about that.
With SouthCoast Health. It's a 101 provider group in South Georgia. It's a big, it's our third largest group that we've brought into the company, and it's they were on a 15-month journey with us to what were they going to do, and it was an alternative to joining a local hospital.
Tell me how you approach the pricing, because that's one of the biggest issues. It's so expensive for people.
Yeah, I think that's the rising cost of healthcare and escalating over the years is really driving provider consolidation. So there's various alternatives for an independent physician of one or two, or like this group of 101, and we've had some as large as 170 looking for alternatives to what could be a structure in order that they could. The payers or funders of healthcare are asking them to provide more value-based healthcare. And with that, they need technology, they need different types of actuarial and data scientists in order to provide those. And most physician groups do not have those types of assets and the ability to retain the earnings enough to actually provide those services for the funders of healthcare.
But is it the structure of the industry, whereas all different players get a cut in terms of, drug pricing?
It's interesting because we've seen some pretty large purchase or acquisitions of drug, of drug manufacturers this week, and I think it's the ability to that one. I think it was on your. I think I saw it earlier that. Those are for innovational purposes. I mean, they need people to innovate, and I think just like us, physicians need somebody that can help them to bring them the capital to be innovative, bring different structures, bring different abilities and compensation models to align incentives that are really aligned towards higher quality, lowering the cost of, and because the consumer today, the patient is asking to fund more of that, and they're looking for alternatives that they can be a lower cost, higher quality, and really a better patient experience for them.
According to a new study from Johns Hopkins, the United States spends more on health care than any other developed country. So what is the answer to getting that price down?
In my experience, you need to involve the physician and the provider, and the consumer as the consumer becomes more educated from and has a larger piece of that cost. They're going to be looking for those physicians and those provider groups that are what I call sophisticated and have the data, have the technology, not just to provide lower cost, but at the same time a better experience. And I think things like the Amazon, Berkshire Hathaway, those type of events are actually pushing providers like us, pushing the insurer, and pushing others to kind of compete in that environment.
Yeah, we're going to talk with Jamie Dimon about that as well. Shawn, it's good to have you on the show.
All right,
Thanks
you.
so much. Shawn Morris joining us from Privia.